Most people think diabetes shows up as thirst or tiredness, but most of the time, the first warning signs show up somewhere you would never think to check. Your feet. That might sound strange. Your feet are far from your heart. They do not seem connected to your blood sugar at all, but that distance is exactly why they matter so much. Diabetes is not just a problem with sugar. It is fundamentally a blood vessel and nerve disease. High blood sugar slowly damages small blood vessels and nerves all over the body. And the vessels and nerves farthest from your heart, the ones that travel all the way down to your feet, are often affected first and hardest. They are the last to receive fresh blood and oxygen, so they are the first to feel the damage. This is why doctors often check the feet before anything else. Your feet can reveal problems with your blood sugar long before a blood test ever does. A small change in color, a strange tingling feeling, or a sore that refuses to heal can all be early clues. Sadly, many people miss these clues. They blame tired feet on standing too long, or they blame numbness on bad shoes. By the time they finally see a doctor, the damage has often grown much worse. In this video, we will walk through 9 signs that diabetes can show up in your feet. We will go from the small and easy to miss, all the way to the serious and urgent. Some of these signs are quiet warnings. Others are the body shouting for help. By the end, you will know exactly what to look for, and more importantly, what to do about it. Your feet might just be the early warning system your body has been trying to use all along. The first 2 signs often arrive together, and they share the same root cause. Tingling, numbness, and burning in the feet are all signs of a condition called peripheral neuropathy. This happens when sustained high blood sugar slowly damages the small nerve fibers that carry feeling to your feet. These nerves are thin and delicate, and they are especially sensitive to harm from years of high sugar levels in the blood. According to the American Diabetes Association, roughly half of all people with diabetes will develop some form of neuropathy over time. That is a striking number, and it shows just how common this problem really is. Yet many people do not realize their feet are trying to tell them something. Tingling often comes first. It might feel like pins and needles, or a strange buzzing under the skin. Numbness usually follows. Your feet may start to feel less sensitive to touch, heat, or even small injuries. Then there is the burning sensation, which tends to grow worse at night. People describe it as a hot, prickling feeling that makes it hard to sleep. Because it builds up slowly, many people brush it off. They blame restless legs, poor circulation, or simply standing too much during the day. The truth is, this slow progression is part of what makes neuropathy so tricky. It rarely shows up overnight. It creeps in quietly over months or even years. The good news is that you are not powerless here. Staying active with daily movement and keeping your blood sugar levels well managed can help slow the nerve damage down. It will not undo damage that has already happened, but it can protect the nerves that are still healthy, and that is worth paying attention to. The third sign is one of the most serious. It is any cut, blister, or wound on the foot that refuses to heal. This is not just slow healing. It can be a warning sign of deep, lasting damage. Here is why it happens. High blood sugar damages small blood vessels over time. Damaged vessels carry less blood to the feet, and blood is what carries oxygen and nutrients needed for healing. At the same time, high blood sugar weakens the immune system. It slows down the white blood cells that normally rush to fight infection and close up a wound. So a cut that would heal in days on a healthy foot can linger for weeks, or even get worse, in someone with diabetes. This is not a small problem. According to the Centers for Disease Control and Prevention, 80% of all lower limb amputations in the United States happen because of complications from diabetes. Most of these cases begin the same way, with a small wound that was not caught in time. That is why daily foot checks matter so much. Take a few minutes each day to look at the bottom, sides, and between your toes. Look for cuts, redness, blisters, or swelling. Because nerve damage can reduce feeling in the feet, you may not feel a wound forming, so your eyes become more important than your sense of touch. There is a simple rule worth remembering, the 48-hour rule. If a wound on your foot has not started to look better within 2 days, do not wait. See a doctor right away. Catching it early can be the difference between a quick fix and a serious complication. Signs 4 and 5 live right on the surface of the skin, which makes them easy to spot once you know what you are looking for. The first is a change called diabetic dermopathy, sometimes nicknamed shin spots. These show up as light brown, scaly patches, usually on the shins. They are not painful, and they are not dangerous on their own, but they are a visible marker that high blood sugar has been affecting the small blood vessels under the skin. Think of them as a quiet flag rather than an emergency. The second skin change is different, and it is worth telling apart from the first. Some people develop brownish or reddish skin from poor venous return, meaning blood is having trouble flowing back up from the legs to the heart. This is called venous stasis, and it shows up more often alongside varicose veins or a condition called chronic venous insufficiency. It is not caused by nerve damage like the first sign, but by struggling veins, and it is still worth mentioning to your doctor. Then there is the fifth sign, cracked heels that simply will not heal no matter what you try. This often comes from autonomic nerve damage, which affects the nerves that control automatic body functions, including sweating. When these nerves are damaged, sweat glands in the feet slow down. Less sweat means drier skin, and dry skin cracks more easily, especially around the heels. This is a well-known finding among foot specialists. The fix here is simple, but it needs to become a habit. Moisturize your feet every night to keep the skin soft and flexible. Just be careful to avoid putting lotion directly between your toes, since trapped moisture there can lead to fungal infections instead. The sixth sign moves us beyond the skin and into something deeper, swelling in the feet and ankles that does not go away overnight. A little swelling now and then is normal, especially after a long day on your feet, but persistent swelling is different. This is swelling that lingers day after day, even after rest. With diabetes, this sign deserves careful attention because it can point to several different problems happening inside the body. Sometimes persistent swelling comes from kidney involvement. The kidneys help control fluid balance in the body, and over time, high blood sugar can damage the small blood vessels inside them. When kidneys struggle, fluid can build up in the lower legs and feet, but that is only one possible cause. Swelling can also come from heart failure. Persistent swelling should never be brushed aside. This is not a sign to manage quietly at home with your feet propped up and less salt on your plate. Those steps might help in the short term, but they do not replace a proper checkup. If your feet or ankles stay swollen for more than a few days, bring it up with your doctor soon. A simple conversation now could catch a heart, kidney, or vein problem early, while it is still easier to treat. Your feet are sending a message that deserves a real answer, not just home remedies. The seventh sign brings us back to the nerves, but this time the pain is sharper, almost electric. It can feel like a sudden jolt or stabbing sensation, often striking at night when the body is finally still. This happens when damaged nerves misfire, sending pain signals even without an injury. It belongs to the same family of nerve damage as the tingling and burning we covered earlier, just showing up in a more intense way. Research suggests painful neuropathy like this affects somewhere around 10 to 25% of people with diabetes. That is a wide range, but it shows this is far from rare. One word of caution, reaching for over-the-counter anti-inflammatory medication every night is not a safe long-term fix. These can strain your stomach or kidneys when used daily for months. This kind of pain deserves a real conversation with your doctor instead. The final two signs, cold feet and hair loss on the lower legs, both point to one issue, peripheral artery disease. This happens when blood vessels narrow, cutting down the blood flow that reaches your lower legs and feet. Diabetes is a major risk factor for this condition. According to the American Heart Association, roughly 8 million Americans live with peripheral artery disease. When blood flow drops, feet can feel cold even in a warm room. That same reduced flow can starve hair follicles on the lower legs, causing the hair there to thin or disappear. Doctors sometimes check for this during vascular exams, since it offers a simple clue about circulation. The encouraging part is that a structured walking program is actually a first-line, proven treatment for this condition. Regular walking, done consistently, can help build new pathways for blood flow and improve symptoms over time. Let us bring it all together. 9 signs from subtle to serious: tingling, numbness, burning, wounds that will not heal, shin spots, skin discoloration, cracked heels, persistent swelling, sharp nighttime pain, cold feet, and thinning hair on the lower legs. Each one is your body sending a message worth listening to. Tonight, take a few minutes to really look at your feet. Then talk to your doctor about a fasting glucose or a 1C test. Many people qualify for covered diabetes screening, but plans vary, so check your specific coverage. One last note: this video is general education, not a diagnosis. It cannot replace a real examination. If you notice new swelling, chest symptoms, or wounds that are not healing, do not wait for an appointment far down the road. Seek care promptly. Your feet have already started talking. Now it is time to listen. Thank you for watching. Please subscribe to this channel and share this video. See you in the next one.